Hi YouTube, my name is Mark and I decided to upload my first video and I'm going to talk about my nursing career and just nursing in general. I know it's a lot of misconceptions and everything out there about nursing and everything. So I'm going to go ahead and discuss some of those issues and topics and everything. And I'm just going to talk about like my whole nursing career and everything. So right now I am currently an LPN from Florida. And before I was an LPN, I was a CNA for about 6.5 years. And I've been an LPN for about a year and a half since last January. So about 18 months I've been an LPN. I just graduated from the RN program last month, and that was a year in length. So I haven't taken my state boards for RN yet, but I'm going to be taking them next month. I'm not giving a date or anything. That's just something that I guess us nurses do. We don't like to tell our tested or anything. But I'm gonna be taking that next month. I graduated the 31st of May, so like a month ago, and I did the bridge program from LPN to RN. So first, I'm gonna talk about my LPN experience. LPN school was a year in length. It was difficult in the beginning, just because I was a CNA and I was thinking like a CNA and I was using like real world experience in nursing school. And that's just something that you can't do. Like going into nursing school, especially being like a CNA or like a medical assistant or any type of like healthcare professional, going into nursing school, you have to cut that off. Like, you have to cut it off. Like, like I said, I was thinking like a CNA in LPN school, and a lot of things that I did was like CNA stuff. Like in fundamentals, I was like transferring patients without assistance because as a CNA, we all know like you rarely get help or anything from anyone, so you gotta kind of like improvise and just do your own thing. So I was doing that, and I got in a lot of dilemmas and everything with the instructors about that because though technically it wasn't the right thing, I was doing it safely and I didn't hurt anyone. But you know, the instructor is always right, so I kind of shifted from the CNA to the LPN. I was like, okay, whatever. I'm just gonna start doing it your way. If that's what I gotta do to get through nursing school, that's what I'm gonna do. So in the beginning, it was hard, just switching mind frames and everything and mindsets. The rest of the LPN program was really just challenging. It wasn't hard. It wasn't easy, but I got through it. Sorry, I'm sick. I'm not feeling well. Um, but I got through LPN school. I graduated in December and I started that January before. So it was like 12 months in length, and I took my boards like a month after graduating and I passed on the first try, thankfully. The NCLEX PN, which is your state boards for your RN, it was difficult for me. It was just stuff that you wouldn't never expect to be on an exam. Like, it was just stuff that I was just like, what are they asking? And you know, I got through that, and my computer cut off at 85, and I was like, oh my gosh, I failed because I didn't know nothing on there. But like I checked 2 days later and I passed. So after I passed, like 2 weeks later, I found a job and I started working as an LPN. And I started working and everything. And like a couple months later, like 5 months later, I started the RN program. And the RN program was a year in length also. And the RN program really wasn't hard at all. It really helped me because I was an LPN and I went through LPN school. And I went to a really good LPN school that really taught us, and I learned a lot. So it really helped me in RN school. And I got through school with mostly A's and B's. I didn't get no C's or anything. And it's not because I was like, oh, I'm not going to get no C's or anything. It's just really because it wasn't like challenging at all. I was okay with getting C's because nursing school is hard. Like LPN school, RN school, it's hard. It's stuff that you don't know. So I was okay with getting C's, but I didn't get any. So I think I did really good or whatever. And I got through that. It was a year in length. I graduated last month, May the 31st. So I did that. So within the last month, I really just been like relaxing and just trying to get back to my normal life before nursing school and trying to hang with my family and friends and everything, because during the program you just really don't have time for none of that stuff. And a lot of people get mad at you because you don't have the time, and it's not because you don't want to hang with them. It's just because like it's nursing school, and nursing school just keep you busy all the time. So I'm just getting back to my normal life. Um, and I've been studying. I haven't taken my boards yet. I'm gonna be taking them next. Well, I'm gonna be taking them this month. I'm not giving my test date or anything. I know some of you are probably like, when are you taking your test? But I'm not gonna be telling or anything. I haven't told anyone, not even my mom. And when I took my LPN boards, I didn't tell anyone but my mom. But this time, I'm not even telling her or anything. I just want to like surprise everyone. Um, and that's about LPN and RN school. The difference between LPN and RN that I noticed, I know it's gonna be different from a lot of other people, are that LPN to me is just really like task oriented. Like you're just performing a lot of tasks and just doing like a lot of busy things. Like for me, most of my day is spent like passing medications, doing like wound treatments, doing like blood sugars, giving insulin, giving like other injections, um, talking to doctors or nurse practitioners or PAs, um, talking to family members, things like that. It's nothing like really, really challenging at all or anything like that. Not knocking LPNs down, because like I say, I'm still a LPN right now. I love LPNs, okay? And I'm also going to include about my CNAs, because I love, love, love my CNAs. They are awesome, and they're awesome, okay? And I love CNAs because I was a CNA so long, so I just respect them and I love them so much, and I try to help them whenever I can. So all the nurses out there, LPNs, RNs, love your CNAs because they can either make your day bad or good. And they have saved me so many times, so many times. So whenever they need help, or if you got the time, just help them. I'm always changing residents and toileting residents and doing whatever I can to help my CNAs if I have time, because we all know that nurses is always busy. Now, about RN, from LPN to RN, I'm going to talk about that. RN school have taught me, you know, a lot more things now as a nurse. RN school taught me more of like why you're doing things. It's not just like LPNs, you doing things like I said, it's task oriented. You just doing things. RN is more like why you're doing things, how you're gonna be doing things. Like it's just like everything into one. So like for example, like for me, I used to just pass medications. Well, I still pass medications. And I just used to read them more and just pass them because the doctor, wrote them. So I passed them. I did what the doctor said. But now as a RN graduate, I question myself a lot more of like, okay, so why is this patient taking this medication? And why is it this medication they're taking, and how it's working in the body? And I'm more like aware of things now as an RN graduate going through the RN program. It taught me a lot more of like, okay, I gotta really think about this now. And it taught me a lot more about like drug interactions, and I learned a lot more like assessment skills because in LPN school you learn like assessment, but you don't learn like a very detailed and thorough assessment. Now I assess because I just want to like learn more, and RN school teaches you a lot more about assessments, and just now as the LPN and working and stuff, like I'm always coming up with like nursing diagnosis for my patients and stuff, and like all before that I was just like, a nursing diagnosis, what is a nursing diagnosis? But now I'm like, risk for injury and like ineffective, airway and things like that. So it teaches you a lot more like critical thinking and a lot more about like the patient as a whole versus just like doing things. And for anyone who's questioning themselves about whether going to LPN school first or going straight through the RN program, it's really all up to you about everything that you got going on in your life and just you in general. Like for me, I did the LPN route first just because I just didn't want to go through go through a 2 year program without making money along the way. I just couldn't be a CNA for 2 years while I was in the RN program and just surviving. So I did the LPN program first to make money and then go back. I know I was gonna go right back in the RN program just because I don't have any kids and I'm kind of like free. Like I really don't have really no responsibilities besides my little bills and things. So that's why I did it first. And I'm really, really thankful because LPN school taught me a lot, and it helped me so much during RN school. And I make really good money as a LPN. Like I make double of what I was making as a CNA. Even after being a CNA for 6.5 years, I make double now, only being a LPN for a year and a half. So that's why I did LPN first. And I think anybody that really don't have the time to devote 2 years, do the LPN route first because it allows you to make money and it allows you to really get that nursing experience to really see if you want to be a RN or be a nurse in general. And for me, it was positive. Like I knew I wanted to be a nurse. And I know I was gonna, like I said, I know I was gonna go back to RN school just because LPNs, you do a lot, but your scope of practice is still limited. Like it's some things that you can't do that only the RN can do, like initial assessments and blood administration and things like that. So I just really didn't want to work with no type of limits or nothing like that. And I just really didn't want somebody to come behind me and have to sign behind me and things like that. So that's one of the reasons I went back to RN school. Plus, on top of making more money, to basically do like the same thing. Just you just have like a little bit more responsibilities as a RN. Um, what else do I want to talk about? I'm trying to think of everything I want to talk about in this video. Like I said, this is my first video, so if it suck, I'm sorry. I'm just home right now with some free time. After this video, I'm gonna go back to studying for my NCLEX RN. Um, so that's that. I hope I covered everything. Um, if any of you guys have any questions about, like anything, it don't even have to be like RN or LPN. Even if it's just CNA, just general questions, just you can contact me or like leave a comment in the comment section or anything. I'm a really nice person and I will respond to you as soon as I get it or I see it. Um, like anything, like I say, anything nursing related, just comment and let me know. Um, other than that, I hope everyone have a good day, a good 4th of July weekend, and I hope to hear from you guys soon. Peace.